Hello trainees. Today we are going to demonstrate first aid methods and learn about basic training. The objectives of this video are: after the session you'll be able to rescue the victim from electric shock, resuscitate the victim by Nelson's arm lift back pressure method, resuscitate the victim by Schafer's method, resuscitate the victim by mouth to mouth method, resuscitate the victim by mouth to nose method, resuscitate the victim who is under cardiac arrest, CPR, cardiopulmonary, treatment for victim who is bleeding, using fire extinguisher to put out fires, practice on workshop safety and discipline. Let's start. Rescue the victim from electric shock. Loosen clothing that may interfere with victim's breathing. Remove any object, including false teeth, from his mouth. Bring him to the ground level. Start artificial respiration immediately. Call for a doctor. Resuscitate the victim by Nelson's arm lift back pressure method. Place the victim as shown. Kneel such that your knees are near the victim's hands. Place your hands on the back of the victim. Gently bend forward, keeping your arms straight until they are nearly vertical and steadily pressing the victim's back. When bending back, your hands should slide down the victim's arms and grasp his upper arm just above the elbows. When you bend back completely, pull the victim's arms towards yourself gently. To complete the cycle, lower the victim's arms and move your hands back to the initial position. Do this until the victim starts breathing naturally. Do not give him any stimulant until he is fully conscious. Resuscitate the victim by Schafer's method. Place the victim and kneel over them as shown. Victim's thighs should be between the rescuer's knees. Place the hands and fingers as shown. Gently bend forward, keeping your arms straight until they are nearly vertical and steadily pressing the victim's back. This forces air out of the victim's lungs. When you bend back completely, remove all the pressure on the victim. This allows air to fill up back into the lungs. After 2 seconds, swing forward again and repeat the cycle 12 to 15 times a minute. Do this until the victim starts breathing naturally. Resuscitate the victim by mouth-to-mouth method. Place the victim as shown. Tilt victim's head back. Use your fingers to position the upper and lower jaws as shown. Take a deep breath and place your mouth over the victim's mouth as shown, making airtight contact. Close the victim's nose. If you dislike direct contact, place a porous cloth over the victim's mouth. For an infant, place your mouth over his mouth and nose. Blow into the victim's mouth gently in case of an infant until his chest rises. Remove your mouth and release the hold on the nose to let him exhale, turning your head to hear the rushing out of air. The first 8 to 10 breathings should be as rapid as the victim responds. Thereafter, the rate should be slowed to about 12 times a minute, 20 times for an infant. Resuscitate the victim by mouth-to-nose method. Use this method if the victim's mouth will not open or has a blockage you cannot clear. Use your fingers to shut the victim's lips. Firmly place your lips around the nostrils and breathe into them. Note if the victim's chest is rising and falling. Repeat this 10 to 15 times until the victim responds. Continue this exercise till the arrival of the doctor. Resuscitate a victim who is under cardiac arrest. Check quickly whether the victim is under cardiac arrest. In cases where the heart has stopped beating, you must act immediately. Cardiac arrest could be ascertained by the absence of the cardiac pulse in the neck. blue color around lips and widely dilated pupil of the eyes. Lay the victim on their back on a firm surface. Kneel alongside facing the chest and locate the lower part of the breastbone. Keeping your arms straight, press sharply down on the lower part of the breastbone, then release the pressure. Repeat the previous step 15 times at the rate of at least once per second. Check the cardiac pulse. Move back to the victim's mouth to give true breaths, mouth-to-mouth resuscitation. Continue this cycle of 15 chest compression followed by 2 breaths. Check the pulse frequently. Stop the compression if the heartbeat returns and stop the mouth-to-mouth breathing if natural breathing returns. Place the victim in the recovery position as shown. Keep him warm and get medical help quickly. Treatment for bleeding victim. Determine the location of the bleeding. Elevate the injured area above the heart if possible. Apply direct pressure to the bleeding area with a sterile cloth. Keep the pressure on for 5 seconds. Check to see if the bleeding has stopped. If not, apply further pressure for 15 minutes. Clean the wound. Bandage the wound with a pad of soft material. Advise the victim to take treatment from the doctor. Use of fire extinguisher. Alert the people around you when you see fire by shouting, "Fire, fire, fire, fire." Then immediately inform fire service. Tell the people to go away using the emergency exits. Put the electrical power supply in off position. Do not allow people to go near the fire. Identify the type of fire. Refer Table 1. Assume the fire is B-type. Select CO2, carbon dioxide, fire extinguisher. Check for its expiry date. Break the seal. Pull the safety pin from the handle. Aim the extinguisher nozzle or hose at the base of the fire. This will remove the source of fuel fire. Squeeze the handle lever slowly to discharge the agent. Sweep side to side approximately 15 cm over the fuel fire until the fire is put off. Practice on workshop safety and discipline. Switch off all the machinery and equipment before starting the cleaning process. Use a mask to cover the mouth and nose. Identify the areas, equipment, machine that needs to be cleaned. Keep the movable items in one place and group them. Clean the dust carefully without damaging any part or connection in the machine or equipment using a cloth. Use wet dusting cloth on areas that are wired. Remove rust on the parts of the equipment or devices using an emery sheet. Do not remove lubricants in the machine while wiping or cleaning. Use vacuum cleaners to suck dust from the areas where a brush or cloth cannot help. Collect the waste materials found in the lab and put it in the specified dustbin. Clean places where grease or oil has been spilt on the floor. Put all the materials and equipment used for cleaning in their respective places. Inspect and ensure that all machines are working after cleaning in the presence of the instructor. Discuss abnormal things that you came across while cleaning with the instructor. Prepare report if the instructor asks for it. Recap. In this video, we learned crucial first aid and basic skills covering electric shock rescue, resuscitation methods, cardiac arrest response, bleeding treatment, fire extinguisher use, and workshop safety. This video emphasizes practical techniques for immediate response. Hope you understood everything taught in this session. See you in another video. Thank you and goodbye until then.